we have Dr. Todd with us, and he would like to give us his views upon homeopathy in US. So can you please first introduce yourself?
So I'm Todd Hoover. I'm a physician from the U.S. I was in practice for about 25 years in both allopathic medicine, homeopathic medicine, and currently, well, as past president of the American Institute of Homeopathy, but also currently on the board of the Homeopathic Pharmacopoeia and also the national vice president for the Liga for the United States.
Okay. So how did you stumble upon homeopathy? What was your first step towards it?
Well, actually, most people come to homeopathy because they have some experience with a medicine. It's like something got cured in there, or they saw something cured and they got very interested. For me, it wasn't like that at all. I was doing yoga when I was very young, and in the practice of yoga, I had some experiences in my body that I didn't understand. So I was looking for a medicine that might access those kinds of experiences. And so I looked at acupuncture, homeopathy, and Ayurveda equally, and I decided that acupuncture would take too long to learn, and that Ayurveda, it seemed like American people wouldn't take to Ayurveda so well. And then homeopathy, I said, this doesn't look so hard. I was a little bit wrong in that assumption because homeopathy turned out to be a very long time for me to learn how to do homeopathy well.
Okay. What is the scope of homeopathy in US? Like if there's a graduate from India and wants to practice there, or what is the education qualification you need there to practice it? What is the scope there?
So medical practice in the United States is controlled by each state. So you have 50 states, you have 50 different rules.
Oh.
So in general, practice of homeopathic is considered a practice of medicine.
Okay.
So in general, and I would say all except for 7 states, the practice of medicine is limited to people with licenses to practice medicine. There is only a specific homeopathic license for non-doctors in Arizona. So you can have a homeopathic specific license in one state.
Okay.
In 7 states, currently, it might be 8, you can practice a medical discipline without a license as long as you inform the patient. As long as you inform the person, you can't call them a patient, you can't call yourself a doctor unless you're licensed.
Yes.
So you can't use those terms, and you can't treat medical conditions.
Okay.
But you could give advice about things like homeopathy in those 7 states, and those are called health freedom states. In the other states, you would need a license because you're practicing medicine and dispensing drugs.
Okay.
To get a medical license in the United States, you need to practice, you need to pass board examinations and these kinds of things. So if you're a homeopathic doctor, say from India, it would be very, very, very difficult because you wouldn't have had the training necessary for an allopathic license, so you wouldn't be able to pass the certification exams for a foreign medical graduate. As I was originally trained in allopathic medicine, so I have a medical license. Under that license, I can examine, diagnose, and treat patients. Whether I use an allopathic drug or whether I use a homeopathic drug is inconsequential in terms of the licensure aspect.
Okay, so basically you need an allopathic degree before you practice homeopathy there.
That's the general accepted way. Now, there are many people who are practicing homeopathy in the United States without a license.
Without a license.
Now, technically this is illegal.
Yes.
And they kind of go about it in different ways. So they say, well, I'm not really practicing medicine, I'm just trying to help people. I'm educating people about homeopathy, but in reality they're practicing medicine without a license. And if something went wrong with a patient and the patient decided to sue the person, that person probably could be arrested for practicing without a license.
Oh, okay.
So they skate on thin ice.
Okay.
So it's a little bit of a closed system currently, mainly because there isn't a separate licensure. And I would say the opposite is true for acupuncture, for example. In acupuncture, doctors can practice acupuncture as a therapy, and licensed acupuncturists can practice acupuncture.
Oh, that can be licensed?
Exactly. So, but in homeopathy, we don't have these 2 things except for in one state, in Arizona.
Okay, so it's not much acceptable there.
It's accepted as it is one of the therapeutic regimens in the United States, because in the United States we had a very long history of homeopathy, and actually at one point in time conventional medicine and homeopathy were equal. in terms of which practice was
Stronger
stronger.
than
It was
the.
about equal, around 1900, they were about
Okay.
equal to each other. And then homeopathy declined because of certain laws that were enacted. Well, not laws, but funding. The funding
Okay.
shifted for homeopathy and for allopathic. And so allopathy took off and homeopathy got
Went
less.
down. Okay. So we at BGen are starting with the online portal that is Homeopathy 360. So like I've already briefed you about it a little bit. So basically we have the latest news, research, events, articles, webinars, videos, lectures, everything on one portal. So can you share your views on how do you think is this idea going to work and how we can improve on it and how can it be appreciated by students and practitioners around the globe?
Mhm. So in the U.S. we have some similar tools to this.
Okay.
And I would say, first off, webinars are really useful,
Mm-hmm.
um, especially if they're interactive. So if there's some way to make it interactive, that's really great because people like to ask questions.
Yes.
Even if there's a way to just type in the questions and then the person who's giving the webinar live is able to do that.
Mm-hmm.
Otherwise, recorded videos are very nice in terms of training because you can then train with people who you may never be able to
Reach.
travel and reach and study with.
Yes.
And it's much better than reading books. Seeing live cases online is wonderful. Um, Sharing information between people who practice homeopathy is really something great. In the U.S. we have what's called a listserv, which is an older tool where people through email interact. So it's not a live chat kind of situation, but it's similar.
It's kind of a messenger thing.
Yeah, it's like Messenger, but it's an older platform through Yahoo, and this is just based on the organization of the American Institute of Homeopathy, which is all many doctors in the U.S. who practice homeopathy exclusively.
Mm-hmm.
So you have people with similar training
Okay.
who are percent who have questions or political things that happen, or it's a way that we all can communicate together and keep updated and everything. And I would say every day I get a bunch of messages, and so you can respond to some or not, and just kind of they go through just like kind of like Facebook or something where you're constantly getting information in and out.
Okay. So a similar portal will always help the students and practitioners.
Oh, I think it'd be great. Plus, you make connections. If you're traveling somewhere or someone's having a conference, you can find out about that. So having a platform like this that has like these are the conferences that are happening, these are the
Yeah,
research projects that are happening, these are the events, these are the kind of meetups if you have
Yeah.
that kind of thing, which is really a nice thing to do as well.
Okay. Thank you so much, sir, for your time.
Sure.